And as we look at the screen here on the Argos, you can see that it has a very crisp display. It's very easy to read, even from across the room, and it's very clean and uncluttered and easy to navigate for the clinicians. Every aspect of the screen is touchscreen and can be navigated with a finger, whether it's bare or gloved, or a stylus. Each portion of the screen has the measured parameters and its associated trend window. Modifications to the display can be accessed by tapping on the screen. This drop-down menu allows the clinician to select from any of 10 various parameters that are always being monitored as the device is hooked up to the arterial line. The blood pressure waveform, stroke volume index, systemic vascular resistance, its associated index, pulse pressure variation, as well as cardiac output, cardiac index, map, and heart rate are all accessible at the touch of a button. Each parameter can be tailored to suit your particular color palette. If you want cardiac output to be blue, you simply activate it that way. If you're accustomed to seeing it in yellow, you can go back to the yellow color, and so forth. As you can see, in each of the parameter windows, there are also secondary parameters that can be displayed to allow clinicians to maximize the use of the available real estate. So in the cardiac output window, we also have cardiac index and percent change selected. When the clinician changes some sort of intervention on the patient, they can press this flag icon, document the change in therapy of the patient. For this case, we will simulate that we're starting an epi-drip. We save that. A new flag is posted in the trend, and the associated percent change will now monitor whether the patient is responding in a positive or negative trend relative to the most recent flag that was posted. This allows clinicians to document interventions, perform various other patient-related tasks, and come back within a few minutes to assess if the patient is responding in a positive or negative trend relative to that flagged event. Those flagged events can also be reviewed, again by tapping the flag icon and choosing the event history. The text that was entered can be edited if a specific dose needs to be added or any sort of modifiers need to be added to that text. And this way, the overall progress of the patient can be monitored throughout therapy. If a clinician comes on shift while the patient has been monitored prior to them coming on staff, they can review the trended information back and forth. They can also pinch and zoom on the data and assess how the patient has been doing prior to their handoff of the patient.